Hi friends, welcome to Diagnox. Today we have a very interesting case where we would see a periapical lesion extending into the maxillary sinus. Most often when we come across root fragments, we just extract them. So this particular case shows us the importance of orthopantomogram as well as cone beam CT scans in analyzing lesions. You can see that there is a root fragment in 2-6. You can appreciate a dome-shaped radio opacity which is extending into the maxillary sinus. We would go into cone beam CT scans and we would analyze whether this is a true periapical lesion which is extending into the maxillary sinus, or this is just a pseudocyst of maxillary sinus which is a mucus retention cyst. So this is the 3D slice. You can appreciate the lesion on the facial wall of maxilla on the left side. So further clarification, we will move on to the MPR images. This is the axial slice, this is the coronal slice, and this is the sagittal slice. We will focus on the axial slice first. So we are in the inferior portion, we are at the occlusal level of maxillary teeth. We would move on from the inferior portion superiorly. So we can clearly appreciate the root fragment. This is the palatal root fragment of 2-6. This is the mesiobuccal and the distobuccal root fragments. So we would move from the root fragment superiorly. We can appreciate erosion of the buccal cortex along 2-6, 2-5 and 2-4. And still moving superiorly, you can appreciate a huge lesion. We would still move superiorly from the alveolar crest. We can appreciate an entire unilocular radiolucent lesion. We can see an expansile lesion with a thin cortex, and we can use this measuring tool to measure the lesion, and it measures approximately 2.5 centimeter into 3 centimeter. So this is a periapical cyst, and you can see the extension into the left maxillary sinus. You can clearly appreciate that this is the periapical cyst and this is a mucosal thickening which is there in the posterior aspect of left maxillary sinus. And we move superiorly, the lesion still goes superiorly into the maxillary sinus. So this is a very interesting case where you see a sinus pathology on the posterior aspect and a periapical pathology which is extending into the left maxillary sinus. We would also focus on the other slices as well. We would move on to the coronal slices, and in the coronal slice again you can clearly appreciate the lesion from 2-6 extending into the left maxillary sinus. This is which caused a dome shaped lesion in the OPG, and you can also appreciate the mucosal thickening on the posterior aspect of sinus. So this is a case of radicular cyst from 2-6 extending into the left maxillary sinus. So we can appreciate a periapical lesion into the maxillary sinus as well as a pure maxillary sinus pathology as well. Stay tuned to Diagnox for many more interesting videos on implants, lesions, etc. If you like our video, kindly subscribe to our YouTube channel Diagnox. Thank you.